What's up, folks? So starting off this little series, we're going to be going through each of the major mobility tools, talking about how they work, how we need to be using them, some rules and some guidance to make sure that we're not abusing them, using them incorrectly, or just simply wasting our time with them. So very first things, and one of the first things everyone needs to be having is massage therapy balls. And we want to make sure that these are good quality therapy balls, not lacrosse balls, not tennis balls, not any crap like that. But we want to make sure that we have the right tools for the job. So typically the big name brand is Yoga Tune-Up, and they have the big variety of balls, 3 different sizes, and it just kind of gives you a little bit more variety in what you can do to yourself, basically. But this is a pretty standard size like this. You can see how it is compared to my face there. And these always come in a pair with a tote. So you can have a little bit of customizability in how you use it, because when they're in a tote together, it's pretty similar to a foam roller, but you can also take one out for getting to the nooks and crannies a little bit better. Now, something to understand about these. These are made out of latex. They are grippy. If you have a latex allergy, you can just simply put a thin towel or a t-shirt over the skin you're going to be rolling out. That will work. Or just make sure that you wash your skin really well right afterwards. I do know people who use a lot of latex bands and balls like these who have latex allergies, and they never have any significant issue because they shower right afterwards. So, but take that with a grain of salt. However you need to take care of yourself, do it. So why is it so important that these are grippy, that these are rubber and kind of soft? Because you can see that they have a little bit of give to them, and that's really important. What happens with a lot of people, how many of you believe that a foam roller, for example, is a torture device? If you said yes, you have been using it wrong your entire life. You've never had good coaching for how to use it well. It is not a torture device. It is a rejuvenation device. It is meant to make you feel better. Imagine getting a hug from somebody that you love. That should make you feel good and amazing. Same thing with this stuff. If you get a hug from someone and it's making you feel awful, it makes you feel horrible, it's painful, it's hurting you, that's not good. And if you think that's normal, well, that's not a healthy relationship with that person. So with these things, how do we use them? The basic guideline for any kind of massage work is that you're going slowly and painlessly. At worst, it feels uncomfortable. That's the worst. It does not feel painful. And there's a couple of big reasons for this. Number one, you should make sure that you're going gently enough that you do not disrupt your breathing. So if, for example, I'm going to massage out my triceps, this is usually a very tender area. So if you want to follow along, if you have a foam roller that works as well, or 1 or 2 massage balls, join along with this. We're going to go for about 2 minutes. I'm going to be starting from just behind my elbow and working up to just short of the armpit, and a couple of different things that we can do for this. But basically what we're working with is nice slow movement, so you can see the pace of it a little bit better. This is the speed at which I'm going. If you can go even slower, then go slower, but no faster than this. We're not rolling out dough. We don't want to just go up and down. And there are some reasons for that, deep physiological reasons, things which we can talk about, but that involves saying things like your Ruffini corpuscles in your fascia, in your connective tissue, the more slowly that they're stretched out, the better they signal your tissues to relax and hydrate. So those are like your proprioceptive sensor cells in your connective tissue. But most people don't want to hear about that. So basically what we're thinking is that you need to be able to relax into the action, and you need to be able to breathe into it if it is stressing you out doing this, because it's so painful. It's making you clench. Well, you don't relax via clenching. You relax via relaxing. Right? So I need to be able to do 2 things. One, I need to be able to make my body relax. And my arm is just chilling as I'm rolling this over. It's not so painful that I'm trying to pull away from it while trying to go down on it, right? Next part is that I'm also breathing as I'm going through this. So assuming that I'm not actually talking nonstop during the video. Ideally, when you're doing mobility work, you don't really talk too much or at all. Sometimes if you're in the middle of a mobility class, you will be talking because maybe we're trying to just have a nice chill conversation, and it helps people to relax. So that's the big thing. Slow, relaxed, you can breathe into it, and you're making sure that you're not creating pain, because that will make you have a stress response to that. It will make your circulation clench up, and you're not going to get the benefits. You're trying to make changes and adaptations in your body. You do not do that as well when you're stressed. The more relaxed you can be, the more you can change and make adaptations in your body. So next thing, we're going to take out 1 ball. So we've covered that indirectly, that when we're creating massage, as long as we go smoothly, we breathe and relax during it, it helps our tissues to relax. I also mentioned hydration. It helps you to actually pull water. When you're doing that, you're actually pulling water into those tissues because dehydration of your connective tissues is a feature that your body can utilize to make things stiffer and tighter. So if you get an injury and your body needs to keep things stiff and tight and non-moving while it's healing, one of the mechanisms by which it does that is dehydration, which is pretty cool. So another feature of this is that this should show up in the camera just fine. So you can see the ripples in my forearm muscles, right? This ball, because it's made out of latex, it's very grippy. So what we can do is actually create a lot of shear in my tissues. So if you look at my skin, can you see that? My whole forearm, can you see how the skin is being pulled around? You can't do this well with a lacrosse ball, which is way too hard. You gotta put in way too much effort with a lacrosse ball with keeping off of it enough. This stuff, you can just relax into it, usually. Very context dependent there. But yeah, so it's not just simply rolling around. I can move it side to side, up and down. I can also keep the ball in place and shear up and down the tissues. Why would I do this? Well, in addition to the tissues just simply becoming dehydrated, that can also lead to the different layers of flesh becoming fused together. So you have the skin, then you have connective tissue directly under that that connects it to the subcutaneous fat, that is the fat just underneath the skin, and that's connected to, well, you have like blood vessels and the nerves that run through that, and then you have the muscles and the tendons, ligaments, and bones underneath all of that. All the structures in your body are connected to all of the structures in your body. Literally, like if you touch your toe on something, the top of your head knows it. And it's kind of intuitive, right? But yeah, creating the shear is important. It helps you to pull all those different layers apart, and it just gives you another dimension of working on your own mobility. Because hey, if you free up the tension around things like your blood vessels and your nerves, things can work a lot better because there's better circulation and better nervous conduction. All right, it makes sense. So that allows you to heal better. That allows you to get more blood flow in so you can be stronger, so you can be a better athlete, both short-term and long-term. And you can do this all over your body. But that's it. That's the basic overview. Only other thing I would say is that per area, per specific body part, you typically want to go for about 2 minutes. But that's your basic, simple, less than 10-minute overview of using massage balls, using a foam roller. Works the same way. They just obviously get in a little bit deeper and tighter. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.